Hello everyone, I'm Dr. 𝒊𝒏𝒂𝒂𝒂, your prenatal family chiropractor, serving Macomb and Sterling Heights areas of Michigan. And I'm here in our x-ray room today to talk to you about why we take x-rays on every patient that comes in with neck pain. So usually, a lot of times in the body, structure will indicate function. So in the spine, we want to make sure the first thing we look at is on your x-ray is the C-shaped curve that you should have in your neck. And that's very important because if that proper angle of the curve is not there in the neck, it causes a lot of pressure on these spinal nerves that come out through your spine, and then also your spinal cord that runs through the back. So if that curve is lost, or it's like a straight neck, what we call military neck, if that's the case, then that causes a lot of stress on the nerves, a lot of stress on the spinal cord in the back, which then will inhibit function. So that's the first thing that we look at with your x-rays. The second thing that we look at are the bone health itself, just to make sure that there's no loss of bone or anything like that, that everything structurally there is healthy. Then we look at the disc spaces between the bones to make sure that the disc health is healthy. And that's important because the discs are how you get motion in your neck. So if it's not moving, then your body is not getting those signals to the brain to even know that it's there. So we want to make sure that that is healthy as well. And then we also look at the placement of this top bone in your neck. It's called the atlas. So that's very important for it to be sitting at the proper angle because your part of your brain stem actually comes out through the back here under your skull. So if that bone itself is twisted, rotated, not angled properly, that will cause pressure on that brainstem spinal cord up there. And you can kind of think of it as a garden hose theory, we call it. So if you have pressure at the top of your garden hose, then it's going to affect the flow of water all the way throughout the hose. So the same goes in your neck. If you have pressure on that brainstem, the top of the spinal cord right there, it's going to inhibit or slow down the flow to the nerves to the rest of the body. So this is why we always take x-rays on our patients before moving on with care, just because we want to make sure what we're dealing with first before we can give you the best care and treatment plan possible. All right, share this with anyone you know that might have neck pain, and see you on the next one.